Straw Hut Media.
I'm trying to like say hey hi to everybody and you're just slurping. Well, excuse all that, y'all, and welcome to Genuinely Gigi. I am here with Slurpaloo, Anita.
Yes, hi.
Do you have to slurp on coffee?
I do. I gotta finish my 24-ounce.
But it's like really cold, and it's not iced coffee.
It's not. Well, maybe if you had a microwave, I could reheat it.
That's a valid point.
So
there is a microwave. It's just downstairs on the floor, and it needs to be brought up. What do you have these muscles for if you're not going to use them?
I'll bring it up. I will bring it up so I don't have to drink cold.
Please bring it
coffee.
up. Please. I can't. I don't have the strength. I have RA. I cannot lift up heavy things. So please, next time, bring the microwave up and settle in.
I will do that.
Thank you for doing that. Yeah. Thank you for having understanding for my RA, which is great because a lot of people do not have understanding for RA because it is an invisible illness and invisible disease. And that's what makes me so excited because we have a great conversation with Dr. Monica Shah. She is recently known from Family Karma. She's on Family Karma. Mm-hmm. Gorgeous. She was in Miss India pageant. Yeah. Beautiful. And she's a rheumatologist. And I'm happy because I got to ask her some questions that I feel like a lot of people might think I was lying about or not really understanding when I would explain, like, I'm on chemotherapy. You know, people
or you're
like,
trying to get attention and you're exaggerating and it's just, it's yeah.
Right. You know, or just in general, being in pain, being tired, and never being able to show up for things with my friends, always canceling just because I'm exhausted all the time. And so I'm happy she kind of cuts it up and kind of lets us know. She also talks about just doing it in a very natural way with medicine. I mean, with not using medicine, with using foods and diet and health and happiness. So here we go. Let's talk to Dr. Monica Shah.
You know her from Shaws of Sunset. You know she doesn't hold back.
My doctors came to the conclusion that because of this freak accident to the pregnancy, because of the shock that happened to my body and getting pregnant, losing it, getting pregnant again, my body got completely confused and went into a full-blown attack.
This is Genuinely Gigi.
I have rheumatoid arthritis, so when I go to these very hot places, I go into it almost feels like flares and my fingers swell up, my joints swell up. I can't walk. I can't really move around too much. I have extreme night sweats. So you were just saying, Dr. Shah, you're just walking from your car into your office and you're just sweating already from the humidity. Girl, that's
I'm
me every day.
Wipe it down. Time to take another shower is what it is.
Oh my goodness. So why don't you explain to a lot of us out there, because a lot of people don't understand what a rheumatologist is. They think a rheumatologist is for people who have rheumatoid arthritis only. So why don't you give it a second and just explain what a rheumatologist is?
Yeah, so basically I'm a physician that deals with systemic autoimmune disorders, primarily inflammatory arthritis. So not only do I deal with rheumatoid arthritis, but colleagues of mine and myself, we deal with lupus, we deal with osteoporosis, we deal with scleroderma, we deal with Sjogren's syndrome, you name it. I mean, if there's a bone or joint involved and it's immune dysregulation, 9 times out of 10, you'll probably be coming to see us.
And for those who don't understand, how would you categorize an immune disorder?
You shouldn't be limited in your day-to-day. And so when it comes to autoimmune disease, that will present differently for a lot of different people. So how you presented, with your initial manifestations of rheumatoid arthritis will be different from the next person and the last person. So that's really where it is. It's an art. And they always call us like the house of medicine because they call us when they don't know what's going on.
Right.
They're like, we checked everything and it's probably autoimmune.
Right. It took me a long time to get diagnosed with rheumatoid arthritis. It took a little bit over 2 years for me to get that diagnosis. I got diagnosed with so many other things. Before that, I got years and years of corticosteroid injections in every part of my fingers, hands, wrists, knees, shoulders. I was told tendonitis, bursitis. I was also a gymnast from the age of 3 till about 13. So they thought it's tendonitis in the hands from, being in gymnastics. Then it was in my knees and they thought definitely must have been from gymnastics. And it's in my, so after a while, someone I think said, "Have you ever been checked for an autoimmune disease?" We're like, what's that? What's an autoimmune?
Yeah, exactly.
So, we got tested, and I was positive at that time for autoimmune. And I remember the doctor sat down and started explaining the course of action for medication. And I just remember the word chemo came out. And my mom said, "What did you like?"
Yeah,
my mom's just whole face went to white, and she just started crying because she couldn't. We were still trying to understand what is rheumatoid arthritis, because you hear the word arthritis and you think old person's disease or illness or disability. And I'll have you know this. This is kind of funny. I have a tattoo on my finger that says RA, and a couple years ago, it was officially changed in the books of medicine that it is now RD, rheumatoid disease. No more. So I'm like, what the fuck do I do with this RA tattoo? Like, I gotta
make the A
I gotta.
into a
The
D?
A could be Anita for Anita, but the R is just really Anita or Rad Anita. I don't know.
I don't know, but could you? You can make this into a D.
While she's figuring that out.
Sorry.
That's actually true. I guess you could.
No, because you can't. You can just add a line in.
I know. You became known to me in a lot of the world from the show Family Karma that's on Bravo. And without me, insulting you, is it safe to say you are Indian?
Correct.
Okay. Now, my aunt married an Indian man, so I have Indian in my family, and they're very vegan and natural remedies of everything. You being a Western medicine doctor, do you practice both Eastern and Western in your approach?
Absolutely. So a good thing is I'm actually an osteopath. So, you think of doctors, you think of MDs. I'm a DO. So I'm a doctor of osteopathic medicine. We go through the same exact training as an MD or an allopathic physician. But the extra bonus of being an osteopathic physician is we spend an extra 300 to 500 hours, I think is the range they've put out in literature, just working on the musculoskeletal system and looking at the body as a whole in a holistic approach. And one of the core principles is that the body has the innate ability to fix itself, and the mind, body, spirit are all one. So I really gravitated towards that.
Right.
And so in my approach, with my training, and then obviously coming from Indian culture, which, like you said, your mom was like, nope, we need to go holistic remedy.
Right.
I grew up with the turmeric is going to solve the problem, and, drink the ginger and all the, natural holistic Ayurvedic remedies that our parents, I hear the terms thrown out a lot. So now with my approach to patients, I definitely take it as a partnership. So I have a lot of patients like yourselves, like you come in with your mom and your mom's like, Golnessa, like this seems like aggressive. And it is, it's overwhelming. It's daunting.
Yes.
You're hearing all these terms. It gets to be a lot, but I definitely partner with my patients, and I'm not a pill thrower. I hate to be like, all right, well, here's a pill. It fixes everything. The first thing is part of the process is fixing and adjusting the lifestyle.
Right.
So there isn't a specific, I get this question a lot. Is there a specific diet for people with arthritis or autoimmune disease? And I get that question a lot. What we do know is that, the addition of like a Mediterranean diet. So basically anything with high in omega-3 fatty acids. So lots of fish oil, salmons, nuts. For those that are vegan, you can do like flaxseed, things of that nature. Implementing that into your diet has shown proven benefit.
So you do inform your patients of both sides of the spectrum. Like, okay, here is the monthly infusion that you're going to need to do and your methotrexate that you're going to need to take. But also, get more turmeric, get this type of diet, eat this. Okay, so I love that. I wasn't introduced that way.
We're going to take a quick break. But when we come back,
it's awful to hear when the patients are in tears and be like, I can't play with my son, or I can't hold my kid.
I can't hold him for like 5 minutes. I can hold him and I have to put him down. My arms will collapse and I will drop him and it'll hurt him. So I have to. I can't not be with someone near me to help me.
Yeah, and supplements aren't going to be like FDA approved. So you're not going to find that. But we do know about the the omega-3 fatty acids.
Right.
And then when they think about, I think a lot of my patients, I do it from experience. Some have eliminated gluten and been like, this is like I feel a heck of a lot better. I have some patients that went keto. They lost a significant amount of weight. I feel so much better. There's less pressure on my joints.
Right.
I have some patients that went vegan. So again, that's the beauty about rheumatology and why I love it so much is that what's going to work for you may not work for somebody else.
Right. Yeah. My situation with my RA, I was actually amazingly well right before I got pregnant. I got myself to that point, working aggressively for many, many, many years to get myself to the point where I was practically in a remission state, where my blood results were reading 0. But just in the physical touching, my doctor could still see a little bit from touching. So it wasn't a full, type of remission concept.
Correct.
But I was there. So I said, you know what? I'm almost 40. Now's the time for me to go ahead and try to get pregnant. I had a very unfortunate situation that happened. And the interesting thing is when this situation happened, 3 of my doctors got together. My fertility specialist, my gynecologist, and my rheumatologist. All 3 were working together, and I had a high-risk doctor when I got closer to birth. But all these doctors through my whole pregnancy had to continue to communicate, because what happened was with my first pregnancy that unfortunately turned ectopic and ruptured, I had to have an emergency removal of both my fallopian tubes, therefore sterilizing my body. 3 months later, my process of getting pregnant started again, and I was pregnant. But 2 months into my pregnancy, not only was every single joint that I had affected before in a flare, new joints were being affected. And when you're pregnant, this is the cool thing about pregnancy, your body usually goes into a remission. But my doctors came to the conclusion that because of this freak accident to the pregnancy, because of the shock that happened to my body and getting pregnant, losing it, getting pregnant again, my body got completely confused and went into a full-blown attack. So my RA came back worse than I had ever had it, ever. And I began infusions while I was pregnant. They had to change the course of action, of course, put me on meds that were safe during pregnancy. But I had to give birth early. I had to induce early because they needed to get me back on hardcore methotrexate and steroids fast, because the inflammation, I mean, you're a doctor, you can vouch, it can reach your pregnancy. It's very damaging. It's not people just, because it's an invisible disease, I think people don't realize how serious and intense of a disease it is. But so, which leads me to now, my son's 15 months old and I'm still doing weekly methotrexate injections, my monthly infusions on top of that. So I'm working on it and it's been a process, but I would love if you can shed light, because I feel like I get questioned almost in a way like people don't believe me because they can't see it on me. Can you explain how it feels like, how it looks like? What is it like in your eyes as a doctor having all these patients with this disease? What is that like? So you could explain it in your words, not mine.
Yeah. So again, and there's a term called invisible illness now, because that's what it is for a lot of people. I mean, now, people think of back in the day when there weren't so many therapies, they'll be like, oh, well, why aren't your hands curved to the side? Like, you don't have an arthritis problem or an autoimmune. Your joints look fine. But really, a lot of it is what we call subclinical, meaning you don't see it with the naked eye. And that's why getting to the forefront of a diagnosis early on is absolutely key. I mean, I have, again, and this is a lot of the same story you told me, you get the runaround a lot. A lot of patients go to a lot of different people because they don't think anything's going on because I don't see anything.
Right.
But really, I mean, your people, I have patients complaining, I have stiffness for 2-3 hours, maybe the whole day. That never goes away. So they wake up with stiffness and they're stiff all day long. My joints swell. I can't grip a coffee cup anymore. I can't button my shirt. I can't zip my dress up. It hurts to walk. It hurts to exercise.
I probably had it for a long time and had no idea. It got to the point where I was seeing a doctor because I went to this silly class with my sister where it was like pole dancing and spider ropes stuff where you would like grab it and you climb up, and everyone was doing it. And I was like, why do my hands keep sliding off? I was like, I'm a gymnast for years. Why are my hands sliding constantly? And I didn't think much of it until in the middle of the night, my fingertips were turning blue. That's when I realized something's wrong. They were swelling up in the middle of the night and all the tips were like blue, like they were about to fall off. And I would have to start doing circles with my arm because I didn't know. I'm like, what's happening to me? I've had surgery on my hand because they just put so much steroids in. The doctor's like, we can't put any more steroids into your trigger finger. Yeah. So they opened it up, did all that. It's a process. And I have to tell you, more than the pain, and this is maybe because I have a high threshold to pain, more worse than the pain to me is the exhaustion. It's the worst feeling in the world. And the best way I explain it to people is by saying that feeling that you have when you have like 102-degree fever and you're just sick and you can't move, getting up to the bathroom, it makes you like out of breath. That's what every second of having my RA feels like. And it's just
so not just when you get like your infusions and stuff. This is
no. When I get infusion and when I have to do my methotrexate injection and I do my infusion, there's this feeling of I don't want to say the word death because that's too extreme, but it's like I got ran over by an 18-wheeler. Like if a lion were in front of me, I would just be like, this is my life. I can't run. So, it's such a fucked up feeling. And the fact is that it's never ending. I don't get a shut off time. People don't realize there's no cure to this.
I thought there was
and that's what it is. It's a chronic disease. And that's the other frustrating part is something that you're currently experiencing is that, a lot of the patients will be like, okay, this is going to fix it, right? Well, I only hope so. And that's absolutely my goal.
Right.
But it can get frustrating for the patient knowing that we have to try probably a whole bunch of different, we have over 23 drugs and that means over 3,000 combinations if I did the math right. But of like what we could possibly use to get you feeling better. And it is a process, and that's the hardest part to convey to the patient is like, I can't fix you overnight and I really want to, and it just becomes very disheartening. And it becomes an emotional conversation because this is your daily life, right? You have a son, you want to get out there and be living life with him and being able to hold him. It's awful to hear when the patients are in tears and be like, I can't play with my son or I can't hold my kid.
I can't hold him for like 5 minutes. I can hold him and I have to put him down. My arms will collapse and I will drop him and it'll hurt him. So I have to. I can't not be with someone near me to help me. Yeah. Because I'm either throwing up from all the medication because I have such a sensitive system to it, or I'm just in too much pain from it. It's like I haven't been able to quite catch a break, which is the irony is I got pregnant thinking I was at my most healthiest and it backfired on me. But I am smoking pot and cannabis does help me. It's temporarily, it helps the symptoms of nausea quite a bit. But it's another thing I wanted to talk to you about was the nausea related to my methotrexate infusion and my infusions and whatnot. A couple of years ago, I brought up my RA on my show on Shahs of Sunset and I talked about it. And I think that, yes, I was in a very weird place with some of my friends at that time. And it was easier for them to say I'm lying. But it's very confusing to people when I say I'm on chemo. And they look at my hair and they're like, is that a wig? Is that, what is she, what does she mean she's on chemo? And then I've also offended quite a few people by saying I'm on. So I stopped saying the word chemo. I was just saying methotrexate, and they're like, what's that? I'm like, it's like chemo. And I'm like, I don't know what I'm supposed to say. And I don't want to insult anyone because the strength of chemo that goes for people with leukemia and cancers is just, it's different, and God bless the medication, but I'm on a different, and I just, I don't, can you explain how this works, how the word chemo is working for someone like me with RA as well as someone with cancer?
Yeah. So, that drug specifically, the doses will vary, like you said, for someone that has a full-blown cancer, leukemia, lymphoma, what have you, and someone with rheumatoid. We're using a very, very negligible dose. So I have had that same concern with a lot of patients. oh my gosh, I know methotrexate's a chemotherapy drug, but the doses that we use, and there is a cutoff dose for methotrexate. So the doses that are used in terms of how we use it in the rheumatology world, the doses is negligible to what you would be getting in a chemotherapy setting. So essentially, is it working on especially the DNA and all of that? Yes.
Well, what is it?
But,
Why don't you explain that? What is the medication doing exactly for someone like me? What is that doing for my RA?
There's evidence that it decreases mortality and it prevents disease progression. So it is working on a molecular level to prevent an inflammatory response, to prevent certain inflammatory markers from being made. And to, just to simplify it in that sense. So it is working on a very, very focused level to help regulate the immune response. But yeah, with it comes similar side effects. I mean, it is the same drug, if you will, but the doses will vary.
Yeah, I do my methotrexate injection, and then 2 days later, I inject myself with B12, and then, every almost 4 weeks, it's my infusion. So I have a needle in me at all times, it's just, I'm so used to it.
So this is something that is just for your rest of her life, and is going to just be regulated and just through different infusions and medication and stuff. And this is something that you'll forever have to live with then. So there's no cure. There's no way to just.
Yeah, unfortunately that is the case. So once we have a patient on whatever works for them, whatever cocktail of therapy works for them, usually
forever.
It's like, if it ain't broke, don't fix it. So then we just try to keep you on. And as long as our goal as rheumatologists is always to have you in low disease activity or remission. And the way we check that are by different markers. Every rheumatologist is different in how they practice and approach and monitor their patients. But it requires, blood work and checking your tender and swollen joint counts and having you come in every few months to kind of get the update. And then, we do trial meds for about 4 to 6 months. And if things aren't shaping up, we switch ship or we jump ship to something else. So there's no shortage of medications, but we also don't want to run through everything and say, oh, this didn't work, and that's the frustrating part. Like I said before, is allowing the medication to at least attempt to work. And that may take up to 6 months.
And then I just have more questions. Is this something that can trigger at any time? I'm in my 40s. Can I just suddenly, or is this something that you just have at a young age? Like you said.
I got it. No. You can get, I'll let the doctor answer, but you can get it if it's also it's genetic, correct?
Right? Okay.
Mm-hmm.
Yes.
So there is a genetic predisposition, especially in patients that have a first degree relative with, RA. I think it's about, you have a 3 times higher likely chance than the average person. But that doesn't mean you'll necessarily get it. It just confers an increased risk.
Okay.
And then there's several other factors, and all the literature says we can't nail it down on anything specific. But when you read about it, it says, okay, well, there's genetics, there's environmental triggers, there's smoking, there's your age, there's different infections, oral hygiene, hormones, obesity, you name it. It's probably.
We can't find anyone in my family that has rheumatoid arthritis or autoimmunes, but unfortunately, RA in general is a little bit new. It's not a very old disease. So who knows if my grandparents or great grandparents had it. From my knowledge, until the day that they were, passed away, they never had joint issues. So we're assuming that, they didn't. But my doctor, my general physician once said this. He thinks that my autoimmune came to play and show itself because I have a very strong history with drugs. And he thinks I just lowered my immune system so significantly. And if it were there and available in my body, that it just kind of showed itself. I don't know. Who knows? There's theories. There's so many different doctors have so many different things to say. I've read quite a bit about it. My boss in New York, I talked to her about it. She has someone very close to her. I'm not going to get details. She has someone very close to her with an autoimmune, and she's very sustainable and Eastern on her approach. And she found out about a doctor that operates about with parasites. They try to say that some whatever years ago, when autoimmune started showing itself in people, was around the same time that we were beginning to strip our grains of bacterias and stuff. And some of those bacterias were essential for our bodies to create a stronger immune system, which is why they say if you eat chicken's feet or stuff like that, it's great for you, or to go earthing barefoot because you raise your immune system. I did so much earthing when I was pregnant, by the way. Oh my God. I have Elijah doing earthing all the time. Because
just go walk around barefoot.
Just to walk around barefoot. I want him to raise his immune system. I know what it's like, So environmental has a lot to do with when your immune system, if you weaken it, if you do drugs, if you drink alcohol, smoke cigarettes, if you live an unhealthy lifestyle. That's why so many people will say, once they do change their diets around, they notice some more internal strength because gluten, for instance, no one's really supposed to have gluten. Yeah. It's not good for any of us, technically. White potato, I'm told is bad for RA. Red tomatoes are bad for our eggplant. I hear from so many, and when you say all these medications, you're not running short. I've been through them all in the last 13 years because your body grows an immune system to medication. I have to keep switching and to find that. Right now, I've had a great cocktail. My cocktail's been for 3 years now. It's Orencia infusion, methotrexate, and my B12, and I'm trying to stay a little healthier. It's been working. I just smoke a lot of fucking weed, man.
Weed is a big
part of that. Smoke so much fucking weed.
We're going to take a quick break. But when we come back...
Get up, bitch! Get up! Oh! I need to practice. Let's come on. What do you... I mean, I know you can't make any recommendations about cannabis or anything like that. But I'm sure you've read the science about it being a very strong anti-inflammatory. In the Indian culture, was hemp ever used in the Indian culture for healing?
Not that I personally was aware of, but I have, with a lot of my patients coming in now, asking for it or questioning, is this something I can add into my therapy? I just felt like I should know a little bit more.
Right.
And, although there are positive health effects, and we do know that, I think that works on two different things. So, you have like the CBD part, and then you have the THC. So, what I have gathered is that the THC seems to work better in the way the mind perceives pain, and then CBD seems to work and localize the pain. And so I feel like the combination maybe have the most promise. And again, I've had patients, what I say is like, it's a hit or miss. So it's worth a try because it's really not, as far as I'm concerned, really going to affect anything else medication wise. And, there's some people that, it works, and I'd rather have them take that than be on chronic narcotics personally. And have that dependence. But I, just on that, like, I feel like the human mind is such a powerful thing. And a lot of the ways that we, patients experience medication is related to the expectation of what the medication is supposed to do. So I feel like, when that being said, they're like, oh, well, it worked for so-and-so, then they have the expectation that it's supposed to do that for them. And it may not, but it is definitely something that, I'm not advocating that that's, the first line of treatment, but could it be something that is used in addition to what first line therapy is? Yeah. I have seen studies that show that it has had a positive effect on sleep and pain relief and quality of life. So, and to each their own. So if it works for you, it works for you. But again, if that were to if patients were interested, I always say, like, talk to your primary doctor, and see which one fits, with all of your other comorbidities and illnesses, what is your best fit?
I'm really, really glad about your answer, to be honest with you. Maybe we just want to high five you and just be like, girl, let's smoke a joint when we see each other. Okay. Oh my gosh. I love talking to you. I'm really grateful for people who go into this field, because there's not a lot of doctors that are in this field that are good at this field and care enough, because it's a very difficult it's a very difficult disease. Autoimmune in general is just very hard. And when I go there every month and I sit in that big fat fake leather reclining chair and they put the IV in my arm and I have to pull out my, laptop or iPad and just watch movies and have my candy here. And every 5 minutes a nurse is, are you okay? Is everything fine? Are you cold? I used to cry for years. Every time they would just put the needle in and start the process, I used to cry. After many years, I was like, okay, I got this. But you never fucking get used to this. And my heart is out to all the people who have to deal with it. And I'm, again, very grateful to people like you, Dr. Monica Shah, that you are caring for people like me and helping people like me, because it is a debilitating disease that can crush you physically and emotionally as well. So thank you for being here. Thank you for answering our questions. We would love to have you back again and talk about other stuff. I'd love to meet you in person.
I would love that.
We'll come out to Florida.
I need to make it out west, or you guys need to come out down south.
You know what? My friend Reza and I were just talking to Vishal, and we were just saying that we need to make a Miami trip happen, and we're going to have a dance-off, Indian against Persian.
There we go. I love it. I went to my first Persian wedding, and I was about it. The napkins were going out.
Oh, that's a Jewish wedding, isn't it? Isn't that Jewish? I don't feel like Muslims do the napkins.
Maybe it's a Jewish thing. But if they invite me to come out, I'm gonna be on the Indian dancing side against I hate Persian dancing.
I have outfits.
She invites herself to everything.
I invite myself to everything, so I'll be there too. With her and Reza.
We all do the light bulbs. We all do light bulbs, bitch. We all do light bulbs.
Bollywood, Punjabi.
Yeah, so let's make it happen. So I'd love to come back. I do want to thank you guys so much though. Like, Golnessa, you have a platform and you're using it to spread awareness. And I truly, as a rheumatologist and someone that's advocating to have more of these conversations, I'm so grateful for you to be able to do this and spread awareness. That truly means a lot to me as a rheumatologist and someone that really advocates for my patients. So I'm so grateful to be on here and and I look forward to having more of these conversations.
Yeah.
Well, don't go anywhere yet, because enough of the serious stuff. We're gonna do. We have a little game.
Anita's about to twist things up. You got a big A right here, like my tattoo. She's gonna figure something out with my tattoo.
I need to figure out what we can do.
This is when I light my joints.
Something clever.
Time for laughing. All right, let's have some fun.
So, forgive me, I have sinned. Okay, so I'm gonna ask you some questions. We're gonna have some fun now. I feel like I should take my glasses off to be less serious, but then I kind of really
don't you need them to see? Now's the time
to use them. Do you need to see?
Now's the time.
No, they're not real. They're fake.
Oh, I got you. Okay.
Oh, yeah. No, they're going to be real soon.
They're for fashion.
They're for fashion, but they will be. You have to go get an actual prescription put in. Okay. Forgive me, I have sinned. So with you having the last name Shah, do you think that you should be the main cast member of Shahs of Sunset?
Oh my gosh.
Oh, she's flicking her hair, honey.
She's
bitch.
It seems like a logical fit to me.
Right? The last question. So
do you have more?
I have one more. So
she's really trying to jab me. All right,
you've done a lot of pageants, and you're so beautiful. And
you are gorgeous.
So, yes, so
like fucking gorgeous.
Very. So, with all the pageants you've done, have you ever once wanted to actually like trip and like push or do anything to one of the other contestants?
Anita.
Forgive me, I have sinned.
Oh my God.
You didn't. I'm sure you didn't do it, but in your mind,
I haven't. But the competitive nature, and girls can be catty and nasty, and
really?
I found that out in that world.
Yeah,
I found that out, and that's why I didn't fit in. I was like, this is not my scene, like at all. Like I did it to step out of my comfort zone, and like be like, you know what, you did something for yourself, like you made an experience out of it, and that was my pure intention.
Okay.
Like my parents, I think, were like, what are you doing? I was doing it during med school. I was like I had bigger fish to fry.
Yeah.
But they're like, what are you doing? And I'm like, I don't know. I'm bored and this seems fun. And like my friends are doing it. So like, why not?
Why not?
That's literally the intention I went in to do it with, was just like, I want to say something, I want to say I did something different. I want to be outside of the shadow of my brother and my dad, because they're just so well known here. So I'm like, I want people to know me for something else.
Right.
And so I did it. But girls can be not so nice. It's a really cruel world out there. So, I'm not saying that don't be mean, but I thought about it because I'm like, why are we being so catty? This is supposed to be like a very fun experience. Like, why is everyone taking it so like cutthroat?
What was your talent?
Like, be real.
What was your talent?
So I've been trained in Indian dance, so I did an Indian dance. And yeah.
Can you show us a little something like a little, you know?
I mean, we're like in AirPods here.
Go, get up, bitch, get up. Oh, Anita, practice. Let's come on. I'm doing it.
I have to post the video. I haven't posted it from there.
That's your Indian music.
I'm doing it. I felt like I did it. I think we're going to win the competition between the Persian Shahs and the Indian Karmas.
Well, especially because I'm going to be
You're
on
not invited.
I'm going to be on their side. Please. Yes, I'm invited. I think
we may win for outfit. So I think I got the outfits unlocked.
I got some cute outfits too. Actually, we have some. Okay.
Monica.
Indian outfits?
Yeah.
Anita?
She actually does. She actually
does.
does.
It was for your party.
She actually does.
Or it was for something. I don't know. Anyways.
Oh my God.
Okay.
Would you let the doctor get back to her patients? Yes. Dr. Monica Shah, thank you so much for joining us. I really appreciate you. Yeah. And I will be seeing you very soon on Instagram.
Yes.
Thank you so much.
Thanks for having me.
Thank you.
Have a great day.
Bye. Oh my gosh. I really, really like Dr. Monica Shah.
Yeah.
I like her. She's awesome. She's so young. She's 30 years old and she's a rheumatologist. She's gorgeous. She speaks well for herself. She's kind.
Yeah. It was really
Wait.
too.
She said she had a brother, right? I remember she said something like, I wanted to do something different than my father and brother.
Yes, yes.
How old is he?
I don't know.
I'm definitely going to Florida.
Yeah, and yes, I'm definitely coming because I'm invited to come with you.
Who invited you?
Me and you. You can't go anywhere without me. Come on, man.
What do you mean? Especially with those glasses on, I'm not taking you anywhere. Like, what am I gonna do with these 4 eyes?
Oh, wow. Okay. I see where this is going.
We should definitely go. Reza and I talked. I was just telling Monica we did this whole Instagram live. We were having so much fun, and Vishal came into the Instagram live, and we were talking. And he's like, "You guys need to come to Miami." And Reza and I were like, "Bitch, yes, we do.
We should go."
Yeah.
But I don't know. I mean, I'm now with all this other crap and the Delta stuff, I'm kind of nervous to go. But
I'm not. Bitch, so I'm talking about in a world where the COVID is like, because especially Florida, because they're in like the dark red zone again. I think for.
So, but
I do want to say about those.
But
red
I do
states,
like the idea.
Dark red states.
And
what
I do. No, I'm just. Wanting to know more about Monica's brother and you. Okay, I'm going to do some research.
We're going to have to talk to Monica when we're done with this podcast. We're going to have to hit her up and be like, listen, how old is your brother?
Okay.
Just let us know.
Okay.
You know,
this could be a good thing.
Is he DTF? Just let us know. You know.
Not let you know.
Well, you're not a part of the brother?
You want to do like...
Well, because if he's not into the hit it and split it type situation, he might be more for you.
Me. Plus, we have to
if he's a hit it and split it, then I will be like, yo.
Okay, so we'll have two options. We'll give him two options.
We'll just whore ourselves out. Yes. Okay, so Dr. Monica Shah, we are coming to Florida to whore ourselves out for your brother. Hopefully he is straight, first of all, because we'll be wasting our time if not. And hopefully he's of age.
That's what I'm saying. The age is.
I'll be like some Kevin Spacey shit, dude. I'm not down for that. like, I'm not down for that. But, I liked her. I liked her a lot, and I'm really looking forward to talking to her again. I like that I now have someone other than my own personal doctor that I can talk to about, you know, having RA and living with it. And if there's any advancements or something new that she can hear about and just send me and let me, you know what I mean? So I'm really happy that she and I got this chance to connect, and she got this chance to talk to everybody.
And I think it's good too, because like now maybe with like taking both your platforms, and I know she's getting there and creating a good one for herself. You guys could really maybe like collaborate and do some cool things.
I would love to do that with her. That's a really good idea.
I know what we should do. We should do a dance off and invite people, and it's a charity event. So
that sounds good. That the proceeds go towards something RA related. This is why you are my bitch. That's the glasses. It's the glasses. Okay, you got to keep these glasses. As weird as they are on your face, you got to keep them because It makes you smart. The weed makes me smart. The glasses make you smart. And hopefully, genuinely, Gigi is making you guys smart. So rate it, review it, subscribe to us. Please. We love you. And thank you for watching.
Thanks for listening to Genuinely Gigi. Download new episodes every week. And if you haven't already, subscribe. And be sure to leave us a rating and review. And while you're at it, check out some of the other great shows available on Straw Hut Media.